Welcome to Modern Musings, conversations with the maiden, mother, and crone, looking at ourselves and the world through the lens of the 21st century. Welcome back to Modern Musings. This is your hostess, Cindy Murray, and I am here today with my co-hosts, Amber Garvin and Kristen Hessler.
Hello.
Hola. And we are bringing up the topic of doctors, and specifically different kinds of doctors, what different kinds of doctors do, what their training is. And this was inspired, I came up with this idea because a lot of people are misinformed about the difference between MD doctors and DO doctors. And so I wanted to kind of talk about that today. So if this is your first time joining us, thank you for joining us, and we hope you'll stick around till the end. We kind of have an informal chat format here in case you haven't ever listened before. If you have listened before, thanks for coming back. And we hope you enjoy this format where we have conversations with each other and with you. What?
Conversations with ourselves.
Yeah.
I couldn't help it. I had to laugh.
Well, I mean, we're having a conversation amongst ourselves. There we go. Amongst ourselves and with you, the listeners, about various topics. And we're all over the place. So forgive us if we get a little sidetracked or we get a little silly sometimes, because we do that too.
Or if our podcast doesn't actually talk about what we said we were going to talk about. Yeah.
We do that too. But we hope you will stick around, because hopefully this will be an interesting one. So like I said, I wanted to start off talking about MDs and DOs because a lot of people don't know the difference. And really there's two distinctions between them. The first and primary difference between them is the type of school that they go to. So MDs go to a specific medical school. They are medical doctors. That's what the MD stands for. And they have a certain theory about how people are treated, how patients are treated. And it's based on medicine. So the guiding principles of a medical doctor are that medicine is used to cure illness. That's the whole idea behind medical doctors. And everything about that type of practice, those kinds of medical schools, is based on what they call medicine. A DO is a doctor of osteopathy. And an osteopathic doctor is more of a holistic approach to medicine or to treatment of patients. So medicine may not be the first course of action in the practice of a DO. And DOs go to a school like a med school. It's a doctor of osteopathy school. I can't remember what they're called, but they go to a specific kind of school. It's different than a DO would not go to the Texas Tech medical school to get his doctor of osteopathy. An MD would go to the Texas Tech medical school to get a doctor of osteopathy. So it's completely different tracks of training, but they take about the same amount of time. But the approach to treatment of patients is different. And so, like I said, the DO is a little more holistic in their approach. They look at the whole body. They often look at diet and other things as they influence the patient. And it's less focused on prescribing medications. They do still prescribe medications, and they are on equal footing with MDs, even though sometimes the MDs will tell you they're not, but they are. And they just have a different approach to why, how to treat medicine. And I actually use a DO because I like having that holistic approach to my care. My doctor is a fabulous DO. She looks at my diet. She, when I come in complaining of one problem, she looks at all the other things going on with me and how those things also relate to the problem that is presenting at the time. She also believes in vitamins and supplements a lot, dietary changes, and things like aromatherapy and things like that. She often does things like that. So I really like her because she just has that approach where she looks at the whole person, not just this one symptom that we're trying, or this one illness that we're trying to treat.
And that's how it should be.
I think so too. And there's, some people like the medical doctor approach to things. They just want a pill, cure this, whatever, and I'll be done with it. But I prefer not to have medication if possible. I am still on a god awful amount of medication that she has prescribed me, but she also makes sure that all my medications, she is an internal medicine doctor. So, or that's what she practices. So, it's like, for people my age, and it's the whole body, so she treats my diabetes. I don't have to go to an endocrinologist to treat my diabetes. She does recommend that I go to, a cardiologist to have my heart checked out and things like that. But if it's something within her wheelhouse, she takes care of all of it. What kind of doctors do you guys use?
Well, I'm kind of in the doctor transitional period right now.
Same.
Yeah, like the doctor that I had before was an MD, but I am really kind of thinking of switching to a DO. Right now, I'm trying to figure it out with my insurance.
Mm-hmm.
I have a doctor's appointment coming up, as I mentioned last episode, and I can't remember if she's an MD or a DO.
Mm-hmm.
She might even be a nurse practitioner, but it was just somebody that I could get in with, that I could have a physical and kind of get the path to good health going on.
Same. I had a doctor. Well, I researched a doctor that I wanted to go to, and when I scheduled the appointment, they were like, "We're going to put you with nurse so-and-so," and I was like, "What?" I'd never heard of nurse practitioner before, and I was like, you know what? I need to see the doctor. I'm just going to go. I don't know why they changed my appointment with the other person, but I'll go. And I loved her. She was a nurse practitioner. She used to work in a prison.
Nice.
And so she was like, "Girl, I've seen everything." And she did everything. She did all of my female exams. She did my guidance on dietary, she was my dietitian, everything. She also helped me with some of my mental meds. And I loved going to her. And then for some reason I didn't go to the doctor for a while. I think it was while I was having my surgery. I was, not needing to go to her because I was seeing the other doctor. And then when I went back, I was due for my annual, and they were like, "Sorry, if it's been over a year since you've been here, we're full now." So then they couldn't see me anymore. So then and I kind of go to one of those minute clinics for emergency
I
kind
do
of
that
stuff.
too.
And so I'd been going to the minute clinic for everything. So I just kind of kept it there for a while. So like you, I'm kind of I don't have
shopping around.
Yeah.
Well, the doctor I had, she moved,
yeah.
And then Blue Cross didn't tell me. And then, because I have an HMO, which is I have to have a referral to do anything. So I have to have a family doctor. And so my doctor moved, and it's been a real challenge because Blue Cross just stuck me with a doctor that turned out to be a pediatrician.
Oh, good grief.
Not a...
Weird.
Yeah, I know.
Weird.
And I'm like,
because
I'm an
that's
adult.
a specialist. You have to have a referral for that. That's weird.
Yeah, and I'm like, well, I'm an adult. And so I started shopping around again. And then they put me with another doctor that was for an adult, and so I go and call them to make an appointment because I finally get my card and everything, and they said, starts February 1st or whatever. I called to get an appointment, and they're like, "Oh, well, we're full. You need to see another doctor at our office." And I'm like, "Okay, well, do they take my insurance? And what steps do I have to go through to get it switched over to now?" So now I have to call Blue Cross again and get some kind of code to give them for me to see this new doctor. And so I spent like a good 20 minutes on the phone talking with the scheduler, and she asked me all these questions that I didn't really know what I wanted. Do you want an MD? Do you want a DO? Do you want a nurse practitioner? And I was just like, well, I'm not really sure. I want a female because I feel like I don't really like male doctors. I don't know why. Probably something psychological, but I'd like a female doctor, and one that'll give me referrals and stuff like that. It doesn't really matter what I see. So now I'm just waiting on the approval to go again.
Yeah, y'all both bring up the nurse practitioner, and I do like nurse practitioners and physician's assistants.
Their bedside manner
is so much. Yes. They're kind of like the they've kind of seen it all because they're nurses,
front line. Yeah.
They are the front line. Yeah. And I really like, for 5 years saw the nurse practitioner at my oncologist's office. I could have elected to see directly the oncologist, but because of the way that the rules for that apply, I only had to see him like once a year, and I actually preferred the nurse practitioner or physician's assistant. I think they've had both in that office. It's been two different people, and I really liked them better because it was for my oncologist. My breast cancer. I just felt more comfortable with the female, but also they're down in the trenches. The doctors don't do a lot of the things that the nurse practitioners. They don't do the triage stuff, and the nurses do, and so they've seen it all.
Half the time, I feel like the nurse is the one making the diagnosis. Behind the scenes.
Well, and with the nurse practitioner,
the right questions,
right? Yes, ahead of time to tell the doctor this is what this is what she's got going on. But I like that, and that's what I've seen. They're overseen by the doctor. The doctor, the nurse practitioner, or the physician's assistant has to be overseen by the doctor himself. So whatever they're doing, the doctor is still looking over what they're prescribing or whatever. And okaying it.
And they wouldn't be working with them in their clinic if they didn't trust them.
Yes.
Yeah.
And I really like that. That's the only, I think that's the only occurrence of one that I've had recently, but I do like it. And I'm not sure exactly what the difference between a nurse practitioner and a physician's assistant are. Except that I think the nurse practitioner starts out as a nurse. They're a registered nurse, and then they go to additional
nursing.
They've got their PhD in nursing or whatever. And then the physician's assistant is a little bit different track of training. They're not a nurse. They are actually a physician's assistant, and I'm not sure how much of the med school or whatever they've had. But
probably like a dental assistant. They can
so
handle
many
a
paths.
lot of the tools and stuff, but they don't actually do the.
So on to the dental thing, we were talking about before the thing, and Kristen can answer these also. There are different kinds of dentists. There is the DMD.
I got a whole bucket for you. There's DMD, which is Doctor of Medicine and Dentistry, and then there's DDS, which is Doctor of Dental Surgery, And then there's DDM, which is Doctor of Dental Medicine. And they're all three the same thing. They just go to a different school and they get that.
So they go to medical school, med school, and then they specialize in dentistry.
And then dental specialists go back to school to get certified in those other. So they're like thrice educated.
Right.
So then you have a couple of them that carry on like similar, you have oral surgeon, exodontist, and maxillofacial surgeon. And all three of those can extract a tooth and do surgical procedures. But like an exodontist just specializes in extractions. And then you have an oral surgeon, which may do like extractions, biopsies. Some of them treat TMJ and things like that. And then you have a maxillofacial surgeon. And those doctors do everything basically from the nose down. And they can treat
plastic surgeries and things like that. And corrective surgeries.
Your neck, jaw, like all the way to your, basically from ear to ear, nose to chin.
Right. And the oral surgeon, if I'm not mistaken, are the ones who put in like posts for implants and things like
actually, general dentists can also do that.
Oh,
they
really?
just go and get the education for that. So if you're looking to do an implant, you could get that from a certified general dentist, which is your DMD, DDS, or DDM. You can also get it from an oral surgeon or a maxillofacial surgeon. I don't imagine many exodontists do that,
Probably
but they
not.
could, but mostly they just extract teeth. Or you can also get it done by a periodontist, which is a gum specialist.
Oh, okay. Yeah.
And then there's prosthodontist, which is a doctor who actually goes back and gets more education on prosthetic, which would be partials, dentures, bridges, implants.
Yes.
Things like that.
And then there's the orthodontist.
Yeah,
right?
That's your braces doctor.
And dentists can actually do those as well.
Yes, and because orthodontists are actually
a
dentists. So they just like to do orthodontic work. So they usually, in my career, I have never seen an orthodontist who also did your regular general dentistry, except we have this one orthodontist. He just likes doing all of it, so he does all of it. But typically, if you go see an orthodontist, you still need to go see your general dentist for like your cleanings and checkups and stuff like that. There's also pedodontists, which actually in the industry we try not to call them pedodontists because that word is kind of
weird.
Sounds
to
weird.
Another word.
Yeah.
So they like to call it pediatric dentist. So I don't know, maybe in a few decades they'll probably change it. And then there's some other ones that are not as well known, like an oral pathologist who does focuses on diseases of the mouth. ENT, which is not really in the dentistry field, but very similar.
Ear, nose, and throat. Yes. Okay.
And then you have a pulmonologist who also helps with like sleep and breathing.
Oh, yes.
And so a lot of times they do stuff like related with your dentist. And sometimes we get patients who are trying to get a pulmonologist, but they're calling us because they don't know who to go to.
Right. And those are the orthodontic devices or what?
For sleep apnea.
For sleep apnea, like a mouth guard or whatever.
Exactly. Yeah. So dentistry is really interesting because it's such a small little area, but there's so many different doctors. And they
are medical doctors. That's what a lot of people don't realize.
And it's all like you have a separate insurance for it too.
Yeah.
Just like vision. So
yeah.
Oh, you were talking
on
about
the vision. I was talking about that one. There's a lot of different kinds of doctors with that too. So there is an optometrist, and they go to school. I'm going to get back up here where I was looking at that because I wanted to make sure that I said it right. So an optometrist has a postgraduate program that's usually 4 years of optometric, I guess is the way you would say that. And so they do basic and advanced eye exams, and things like that. And they can prescribe you glasses and stuff like that. And they usually also have some clinical training and they have a residency that they complete just like a medical doctor. Um, Ophthalmologists are also very similar, but they have a longer residency program. So it's usually like 4 to 7 years to go through, and they have training for certain subspecialties of eye disease.
I was about to say that's a disease. The ophthalmologist.
Yes,
Yeah.
and so like my mother saw an ophthalmologist, and when I was younger, I actually saw the same ophthalmologist instead of an optometrist as my regular eye doctor, just because that was who she went to. So she just signed us up to go to him. But the reason that she went to him was because she had some optical nerve damage when she was young. She had a bad case of hepatitis when she was very, very young. She was very, very ill, and it did some damage to her eyes. So she had to see an ophthalmologist. And then there is also what they call an optician. And and the ophthalmologist can do surgeries on your eyes.
I was about to say, would that be the cataract surgeon?
Yeah, they can do surgeries. They can do like retinal reattachments and things like that. So, and then the optician is the person who works in and alongside the optometrist or the ophthalmologist. So often they are a little bit of customer service. It's usually a very short program, like maybe an associate's degree. They can fill prescriptions for glasses. So often the person who fits you for your glasses or, things like that, they can answer some questions also, and they might do some of the testing in your optometrist office, like the glaucoma tests and things like that. They will run those machines.
Are they
and
also
stuff.
considered eye doctors?
No, they are not doctors.
Okay.
So they are technicians.
Got it.
So,
Okay.
So that they can do stuff like that. And then, so that's what we have there. And, so there's some different things there, and some, you can go to an optometrist or an ophthalmologist interchangeably, like my mother and I did. My mother had to see that one, but I saw the same optometrist or the ophthalmologist for a long time. I saw. I did. I saw. But so that's the difference there. Another one that people don't really know the difference between is a psychologist or a therapist and a psychiatrist. And they're, depending on the state that you live in, the training for a psychologist is different. Different states have different.
I want to say, the training's different anyway. Like one can prescribe medicine, which is the psychiatrist.
That's a psychiatrist, but I'm talking about psychologists or therapists. It actually varies by state. Some states will let you practice as a psychologist or a counselor with a bachelor's degree. And in the state of Texas, you actually have to have a master's degree, and specifically in counseling or therapy of some sort. So, which is what my niece Ashley is going to school for. And so, like a psychologist, their training is, they have a bachelor's degree, usually in psychology, and then they have their postgraduate work, however long, whatever program they're in, and whatever their specialty is. So there's like school counselors, there's therapists, there's licensed LPCs, I think is licensed practicing counselors. I'm not sure if that's the right terminology. Versus a psychologist or a psychiatrist, which is what you were talking about. A psychiatrist is actually someone who goes to medical school, like they are an MD.
Well, no, there can be MDs or DOs.
Or DOs, yes. But they are licensed medical practitioners, not therapists. So they generally don't give therapy, but they can prescribe medication.
And there's also like a psychiatric nurse that can also, that has the doctorate in psychiatric nursing that can also prescribe medications.
Yes.
And you can actually be a life coach and not have a degree too. So watch out for that too.
Yes.
Yeah, anybody that says life coach.
Check their credentials. Yeah. There's a difference in different states about the licensing. So in some states you can, I believe, be licensed to provide therapy with just your bachelor's degree. And in fact, I had a friend who went to school in another state, and she was going to practice therapy, or she was going to, go into practice in that state, but she moved to Texas and then found out she could not provide counseling services in Texas without going to more school to get her master's degree. So she wound up not pursuing that any further.
Yeah, and had she known, now the term life coach is really common. And I think there's a stigma for some people about therapists. They might choose to go to a life coach because that sounds more like on their, like some people think, oh, a therapist. We had this whole discussion when we talked about mental health. Some people don't like going to a therapist because it sounds like you need help.
There's something wrong with you.
But life coach is someone who lifts you up and elevates you.
Yeah.
And man, she could have promoted herself as a life coach, and she could have used what she learned with her degree to be a great life coach.
After watching Ashley go to school and learning the things she learned, she's learned a lot about, not only do they have psychological classes, about the psychology of the human brain, they take chemistry of the human brain, and figure out how the chemistry works. They also have classes in sociology and social dynamics and, things that we don't even think about. They have to learn how different social norms affect people's mental health and or their belief systems and stuff like that. And so there's a lot to it there. So somebody with just their bachelor's degree in psychology already has a great deal of knowledge about the human psyche, and you could really use that information to do life coaching or job coaching. There's a lot of different kinds of things like that are very similar to therapy, but they're geared towards that specific topic.
Right. Even if you have a bachelor's degree in education like I do, I did extensive studies on the psychology of children.
Absolutely.
In college to prepare and to prepare the different types of personalities that you have when teaching children and the different types of psychological damage that children go through as well. And a lot of teachers go on to get their master's in psychology, which is something that I plan on working on as well, get my master's in psychology, because you don't have to have a bachelor's in psychology to get a master's in psychology.
You can change what your focus is.
Yeah, and so that is one of my ultimate goals in my career, is to get my master's in psychology so I can be a school counselor. And even on the everyday basis, there's always at least one crisis that I have to handle a week, as far as on a psychological level with the teaching of middle schoolers.
Yeah.
I know if my career ever panned out or changed, or I could just pick up and start my own quote unquote business, I think I would be a life coach. That would be my dream job right there.
In a lot of ways, a lot of the things that we do here on the podcast, that is what we do.
Oh, and that's the part of my job that I love doing.
Yeah, if you look helping people up.
If you look at modern musings on Google, it says life coach. I don't know. None of us put that on there, but it does say life coach.
Okay. There we are.
Google says that
my
we're
dream.
a life coach.
Well, and as a person who used to work in daycare, we did a lot of developmental classes and things like that with with our adult education training that we had to have. We had to have lots and lots of continuing ed to run the daycare center, and that a lot of it was psychological based training. Mm-hmm. So because and it's a good thing, because you want those people taking care of your kids or who are teaching your kids to know them, yeah. You're molding those children, and so you want to make sure that they have that good background and can
they're not accidentally doing harm,
doing damage. Yeah.
So definitely, if you're going to take your child to daycare, to really vet the daycare, because anybody can pretty much own a daycare nowadays. You know what I mean?
Yeah,
so
they have to pass the state tests or whatever.
But I would definitely I had a friend that put their child in daycare, and that daycare pretty much didn't just let them free for all, and her child fell off of a table and went into a coma and had brain damage from that daycare. Oh. So I'm very skeptical from hearing stories like that about daycare, because they just kind of some of them just throw all the kids into a room and just sit there on their phone, don't pay attention.
There's good and bad of all, of in every business, doggy daycare, people daycare, nursing homes, that exists in all those places. But there's and I want to throw another one in there. The psychiatrist. I do want to mention though, the psychiatrists prescribe meds, but they generally do not do any kind of talk therapy. They will often recommend that you do see a therapist in addition to your medications, but they don't generally provide that therapy. And that is one of the distinctions there. If you are really looking for the whole big picture, you're going to have to see more than one doctor for your mental health things, for your depression or whatever. They are not going to fix your depression. They're just going to medicate your depression. And that's a whole nother episode right there.
Yeah, there's no quick fix for that.
Yeah. But there's also sociologists and social workers. So social workers often have a very similar track to psychologists. They don't necessarily, they don't provide the talk therapy, but they are there kind of in that life coach capacity, sort of. They're not there to listen to your woes and help you solve your. They are there to help you solve your problems, but they often work in very specific environments, like within the school or within hospice or within social
mental hospitals, which is what my mom did.
Yes.
Yeah.
And so, and what they do is they're there in those very specific capacities to help families or individuals move through a transition or deal with, like the transition to hospice or, dealing with death or long-term illness or disability and things like that. And they're not really there for that talk therapy, but they are there to guide their clients with advice on how to get resources and get the help that they do need. So that's another one that kind of falls into that same category, because they do have very similar training to the psychologists, and sometimes they have the same degree track for their master's program. So where you can choose to do one or the other. So that's another difference there. I did want to talk about, internal medicine. A lot of people don't know what that is. And there are lots of different kinds of doctors. There's gerontologists, which focus on elderly patients. There is internal medicine, which is they kind of focus on the organs and stuff, which is what my DO is. She focuses on your heart and your lungs and your liver and your pancreas and things like that. There are urologists, which focus on your urinary tract. There are gastroenterologists, which focus on your gastric system, your digestive system. There are cardiologists and pulmonologists, which focus on your heart or your...
An oncologist.
Yes, and the pulmonologists are for your lungs. Mm-hmm. The oncologists specialize in cancers and tissue disorders. And then there's radiologists, which are focused on radiologists. Yes, they focus on reading MRIs and things like that. So there's a difference there as well. That's another one. There are radiology techs.
Mm-hmm.
Then there's radiologists. So the radiologists are the doctors who read the x-rays, read the MRIs, read the CT scans and things like that. And then there's the technicians, who are the people who actually run those tests. So that's a little bit different there also. And there's
are anesthesiologists considered doctors too?
They are.
Yes,
okay. They are. They get a medical thing, and then they focus on anesthesia is their specialty. There are neurologists, which focus on your nerves. Dermatologists, which is skin and hair.
Mm-hmm. What's the foot doctor?
That's a podiatrist.
That one's interesting because they have...
Their name is different.
It
yes.
is.
And I don't know the specifics between that. And then there's orthopedist,
mm-hmm.
which are and orthopedic surgeons, which are focused on your joints, your bones.
They can also do feet as well.
Yes, they can.
Okay, let's talk about one here. Chiropractors.
Okay.
That's more holistic.
It is
right.
more holistic in approach, so it's a different school.
They are not considered
a medical doctor. They are not an MD. They are a doctor of chiropractic.
Mm-hmm.
So they have gone to school and they have received their PhD in chiropractic medicine.
Mm-hmm.
And they are often more holistic in their approach because they do things. They also believe in things like often believe in things like aromatherapy and alternative treatments, but they mainly focus on aligning the spine. So if you have poor muscle control, if you lift things by stooping over and lifting it up instead of squatting and lifting, you throw your back out and things like that, or if you sit with your head cocked or whatever, there's different things that you can do that get your spine and your other major bones out of alignment. And what they do is they are practiced at feeling where those bones are and basically putting them back into alignment. It's sort of like dislocating your shoulder.
Mm-hmm.
So if you dislocate your shoulder and you go to the emergency room, the orthopedist is going to come in and knock your shoulder back. They're going to pull your shoulder out and get it back into the socket. Chiropractors do something very similar with your spinal alignment. And that's what they do, is they just focus on your neck and your spine and your hips. So a lot of doctors, a lot of MDs do not give a lot of credence to chiropractors, but DOs tend to be more accepting of them because they're of a similar school of thought.
Mm-hmm.
So, and then there's also pharmacological there's different specialties there as well.
Mm-hmm.
And I don't know anything about the, pharmacy school and stuff, but I do believe that there's, it's similar to med school, but it's different. So you get your chemistry degree
Mm-hmm.
and then you go to pharmacology school.
Mm-hmm.
So it's a little bit different, but similar.
Are we talking about like every single kind of doctor?
I don't know.
now?
Yeah.
I'm just
Because
talking
we
about
just
some
got
different
into
ones.
like pharmacology now, then there's like chemists and
Yeah.
making the medicines and and
Well, there
biologists.
a lot of people don't
and-
know, and
Mhm.
and a lot of people don't know that the pharmacist and the pharmacy techs are two different people.
Mm-hmm.
There are pharmacy techs who work in the pharmacy who take the prescriptions over the phone or whatever, but it's generally the pharmacist.
Well, that's
who
like
does
an
all the
associate's
packaging.
degree. The pharmacy tech is an associate's
Yes.
degree. It has nothing
And they don't
near
dispense
what
medicine.
a doctor.
They don't dispense medicine, but a lot of people don't realize
They
that
can't prescribe it
most of
either.
those people in the pharmacy are not pharmacists. Usually there's one pharmacist and a bunch of techs.
overseeing,
And
the
a pharmacist cannot prescribe medicine either.
Mm-hmm.
They just understand the interactions between medications and the side effects. And so that's what their specialty is.
And they oversee and make sure that the pharmacy techs and staff follow the guidelines.
For dispensing medicine or
Mhm.
whatever. Yeah.
Mhm.
So that's that. So, does anybody have anything else?
No.
I think we've covered quite a bit
Covered
there.
it all.
I know there's a lot of different kinds of doctors that we have not talked about, but
So sorry if we left you out.
yes.
Yeah, maybe next time we'll get into like.
Or if you
different
have a
doctorates.
doctor, if you have a different kind of specialty doctor, and you know the difference between it and another kind of doctor, share it with us. Over on our MMC chat, or on our blogs. I don't know what we're going to blog about for this one. But we'll have something interesting to say, and you're welcome to go over and comment on that as well. But, I hope it was enlightening, that you learned something from this little chat about the different kinds of doctors. I learned some stuff about dentists and orthodontists that I didn't know. So I really had no idea there were that many different kinds of dentists. But I've seen the DMD and the DDS. I just didn't know what they were.
Yeah.
So yeah, there's some good stuff there. So I hope you got something out of it. So what is coming up next week?
Oh, Lordy. We
Yeah.
got one for you. We got a winner for you.
Okay,
next
so we've
week.
been talking about heavy, thoughtful stuff. So now, yeah.
Time to get goofy.
Right. Next,
Literally.
next week, we're going to be taking a quiz called Which Disney Princess Are You? And we're going to share our results on the podcast. And we're going to talk about what kind of princess we are. And then princess, not princes. What kind of prince? Anyway.
What kind of prince you want?
Yes. What kind of ladies we are and what kind of princes we want. And we're going to definitely, I'm going to pose this question. You be thinking about it for next week. If you were a damsel in distress, which Disney prince would you want to rescue you?
Mm-hmm.
Oh.
So y'all think about that. And Cindy?
That's a lot of thought there. But anyway, so come back next week. Sounds like it's going to be a doozy.
Right.
We want to give a shout out to Red Door Studios and Creative Audio Tech for our music and our equipment. Not in that order, backwards. And and we hope that you'll get over on our blogs and our MMC chat and carry on this conversation with us, because if you're only listening to the podcast, then you're not getting the whole story. So come on over and be part of it. Be part of the conversation. That's
we forgot
what we want.
OBGYNs.
Oh, yeah.
I was like, I know we're forgetting something.
Oh, you want to
Yeah,
throw that one in there?
that's
What's the difference between an OB and a GYN? Do we have to discuss that?
No. We really don't need to discuss
If
all
you don't know, go do your
all
homework.
the nitty, and then urologists for the males as well.
Yeah, I did mention urologists.
Oh, we did?
but
Okay,
Women go to urologists as well, though.
Yeah,
Yes, they
okay.
do. Because
Oh,
it's for
what
your
about a
whole kidneys and everything.
proctologist? Okay, let's stop.
Yeah, let's go back. Back away. Back away. Put your hands up and back away from the subject.
Step away from the vehicle. You're
Yeah.
driving in the wrong lane.
All right. We will be back next week with something that'll make you laugh just as much as that did. Bye.
Bye.
Bye.